Here at Paper Lotus Massage Studio and Art Gallery, there's no shortage of creativity. Art lines the walls, origami hangs from the ceiling. Kristen and Chris Brazel are living their dream, combining their artistic talents with hands-on healing.
The same kind of thing, the creative flow, because when you massage, you don't have to keep within certain techniques. You kind of can do your own thing. So it's artistic in that way.
Origami, I've been doing that ever since I was 11, probably. I didn't have a whole lot of money growing up, but I could always get a piece of paper and go to the library and learn.
The couple met at a hospital where Kristen worked as a registered nurse and Chris worked in the pharmacy. They both held stable jobs, but Chris grew restless and started looking for a new career.
She already had her career going, so I was just looking for something that I was actually passionate about.
I started helping him look for schools, so when I was looking for schools, I started to get interested in it also, so I thought, well, hey, why don't I go with you?
So the pair decided to enroll in the one-year massage therapy program at Gaston College. The program requires 500 classroom hours, 50 hours of hands-on massage, and a state license to practice. Confident they had what they needed to get started, the two took their education a step further and launched their own massage therapy office.
It's definitely a growing industry. It's definitely not like it used to be where people just thought it was just for relaxation. It's actually beneficial to your health.
Chris and Kristen are part of the allied health profession, which includes healthcare providers who are not doctors or nurses. According to the U.S. Department of Labor, 60% of the country's healthcare workforce is made up of allied health professionals. Kathy Flores heads up the medical assisting program at Central Piedmont Community College. She says the need for allied health workers in a variety of occupations is extremely high.
So we're talking surgical technologists, so surg techs, cardiovascular technology, we're talking pharmacy tech, medical assisting. There's a wide variety of areas, medical laboratory technology.
Those health careers don't require a 4-year bachelor's degree. Instead, students can opt for a certificate, 1-year diploma, or 2-year associate's degree. Flores says some students find the lower tuition cost and shorter classroom time more beneficial. The flexibility of the programs is also a big draw.
After a few years, you may say, you know, I really enjoyed this, but now I want to move to something else. So it gives you the exposure, and you haven't spent 4 years in college and now feel like you have to stay in that profession.
Flores says 3 of the top allied health positions include careers as a medical assistant, pharmacy tech, and health information tech. Each area has its own unique education program and list of requirements. To become a medical assistant, students must earn a 1-year diploma. The salary ranges anywhere from $11.10 an hour to $26.02 an hour.
The medical assistant is the one who checks you in, the one who will take you and do your height and weight, will prepare you for the physician, give you injections, do ECGs. So they're replacing some of the nurses in the doctor's office.
Education requirements for a pharmacy tech vary depending on the position. Students can choose between earning a certificate or 2-year associate's degree. The salary ranges from $12.37 an hour to $25.31 an hour, depending on the level of education.
Sometimes pharmacy techs want to go and be pharmacists, so they'll go for the associate degree first and then they may move forward. If someone is unsure if this is really what they want to do, they might go ahead and do the certificate. The thing with the certificate is they usually can't work in the hospital, so they're more limited as to where they're able to work.
The education requirement for a health information tech is a 2-year associate's degree. The salary can range from $21.58 an hour to $37.28 an hour, depending on where you're working and what your responsibilities are.
And depending on what you're wanting, medical assistant is going to work in the doctor's office. That's great for people who want to work Monday through Friday, 8 to 5.
Flores says many of these health education requirements are offered at local community colleges or hospitals. It's also important to find out if the program is accredited. The college's website is typically the best place to start researching possible programs.
I would recommend first meeting with an academic counselor. They can do a variety of things. If you've been to school, they can review your transcript. They have profiles that you can take to see where you may fit in as far as a career path, and then maybe make an appointment with a particular program chair regarding that career to see what are the options, what do I have to do to get in.
Flores says many of the allied health professions also require a certification. So when you're looking into which program to attend, Ask the admissions counselor how well their students perform on the necessary tests. Also, ask yourself if the health career you want involves direct patient contact. Not all health professionals work directly with patients.
What is nice about allied health and different things is that you can have flexibility in where you want to work and what you want to do.
For the Brazzles, owning their own massage therapy center turned out to be a rewarding decision. Not only do they get to work one-on-one with clients, but they also get to embrace their own creativity. With every stroke of her paintbrush, Kristen challenges herself to let her imagination run free. She says that skill also helps her as a massage therapist.
It's just hands-on healing. You heal with just your hands. There's no medication or surgery involved. There are massage therapists that work with chiropractors, massage therapists that work in hospitals, help with cancer patients.
The couple never imagined they could combine their artistic passions with their passion to improve lives. Now, Chris says he can't imagine working in any other career. He says the convenience of taking classes in the evening while still working his previous job made it that much easier to pursue his dream. Not to mention the price tag.
I know a lot of people that are still paying all their schooling back, and we're done paying for our college stuff already, so that was definitely a plus.
The couple sell their artistic work on their website or inside the gallery and therapy center. And while they continue to build their future one piece at a time, their hope is to one day expand their business and open multiple offices.
For more information about high-demand careers in the healthcare field, check out CentralinaWorks.com and CharlotteWorks.com.